welcome all of you here today for, I think this is our fourth or fifth session. Fourth, okay, on sharing possibilities and self-direction. As you know, we are delighted here at the Community Education Living Project here at Rutgers to support DDD in these efforts and co-sponsor these monthly conversations, as we like to call them. We are now in our fourth session, and we are thrilled that you're all back for our next one. Today's program is called Fiscal Intermediaries and Self-Direction. How do I begin? We actually have three presenters today. We have Donna Shireman from PPL, along with her colleague Suzanne Crisp, and also Asia Tang from Easter Seals Agencies with Choice. And we'll do a formal introduction for everyone as we get started. Trisha, before we dive in, can I turn it over for you for a quick, okay.
So I'm going to give it a little bit of an overview. We've been building these along the way with our new Office of Education and Self-Directed Services, which is a area which is new. It's a new office, a new unit. Our goal is to provide a centralized place for the delivery of education and training for people with intellectual and developmental disabilities who are receiving services, their families, advocates, support coordinators, interested community partners, and other internal and external stakeholders. We are staffed by subject matter experts on best practices in self-directed services. We are here to provide education and support so that people under division services can live their best lives. You can move to the next slide. Our core belief, we're really working with the community practice for supporting families, is that all people and their families have the right to live, love, work, play, and pursue their life aspirations in their community. When I take a chance, our staff are on today, but just so I'm going to put a picture to all of us, and we are all at the end of when you write into our help desk. You can see our faces. So it's myself, Patricia Brennan. Jessica Lycona is the assistant director. She is out of our Freehold office. Kimberly Jessamine is in our Flanders office. Adam Weir in our Trenton office. Christine Jones is also in Flanders. Will Billups is in our Trenton office, and Marguerite Lon-Chambon is in our Mays Landing office. So you can see that our office spans the top of the state all the way down to the bottom where our state offices are. And we have been building these sessions with the Community Living Education Project. So the first one was an open house to get you to kind of know, where we are, who we are, our partnership, and what else you were looking for. The next one we built upon was support brokerage. So we worked together with the Bog Center, who does the trainings for support brokers, to say, okay, so if you're looking to self-direct and you may need a little assistance self-directing, how do I do that? What's the next step? So that was our second one. The third one is was circles of support. So, okay, so I need to figure out how to build my circle of support within my community. So that was our next one. So now we've moved on. So we're kind of evolving through the process. So I'm thinking about self-direction. What do I need to know? Who can I contact? That was the first session. Second session, okay, maybe I need a supports broker. What do they do? Second session. I need to establish some more circles of support, get engaged in my community. How do I do that? Next session. Here we are today. So these are all our staff with the final session of Fiscal Intermediary. Final session for now is that we're building a long way. So today's session is, we do have more sessions, just the final session that we're here at right now is the Fiscal Intermediary. So that's the next step in the process. This is our whole entire office. We also house the waiting list and any special projects. We've got an amazing team that has been partnering with these great folks here at CLEP.
All right. Thank you.
And again, just to add, we do have a spot on our website, and we do have a help desk. So if you have questions, maybe I want to self-direct, I have questions about support brokerage, I have additional questions just in general for us, you can write in. One of the staff that we always have a person staffing the help desk every single day. One of those lovely faces you saw on that screen that are also in attendance today will answer your question. And if they don't know the answer, they will get you the answer. So feel free to write in. And these slides will be available to you.
Yep, they will be sent out afterwards. Thanks, Trisha. And so let me just share briefly who we are at the Rutgers Community Living Education Project. We are a small but mighty team of 7 professionals, 4 of whom are also family members themselves. So not only do they have decades of lived personal experience, which really helps to be sure they kind of know exactly where you're coming from and what you're experiencing, but they also have decades of professional experience. And the role of CLEP, which is funded by DDD, is to guide and mentor families through the process of exploring community living options. And that may not be something that you're necessarily considering right now. Perhaps your loved one or yourself as a self-advocate live in your own home or your family home. But should you be interested in exploring other community living options, CLEP is available to help with that. As I mentioned, we've been funded by DDD since 1991, and we do serve the entire state of New Jersey. And we're based here at Rutgers at the School of Public Health. These are the lovely photos of the voices behind the phone calls and the emails. Natalie Trump, Melanie McGackin, Ann Martinelli, and Mary Canor are the 4 members of our staff who are family members and who kind of bring that added dimension of experience to their work. Maria Schiavello, who is one of our newest employees, has extensive experience as a support coordinator, supervisor, and support coordinator. So she has that real knowledge of the role of support coordinators and how you can work with your support coordinator best. Laura is our wonderful communication specialist. So all the Facebook posts, the social media stuff that happens, we attribute to her. So we do, again, encourage you to follow us on Facebook or Instagram, whatever social media you may use, just so you can keep on top and abreast of what's happening here. So I think you're probably all Zoom experts by now, but just a quick one. If you have a general comment, a thought, an observation, please use the chat feature. You'll see it in your toolbar right here. If you have a specific question, when we get near the end, feel free to kind of raise your hand, or better yet, if you can use the Q&A feature. That way we can ensure that all of our panelists can actually see your questions and they can kind of see who may be best to answer that. So the Q&A, we'll keep drawing your attention to the Q&A feature. I will just add that if you have a kind of a specific question, please try to, not use any individual names, try to maintain, confidentiality. We don't want that appearing publicly, or certainly not in the chat box. But if you also have a very specific question to something that might be unique to your circumstances, we will likely keep referring you to the appropriate help desk. If it's not DDD's help desk, then it may be Easter Seals or PPL. So some of those very personal circumstances we really may not be able to answer here in this space. Everyone is muted at the moment, just so we can limit the background noise. And so I'm just going to go do a quick poll. As you know, we like to try to get a sense of who's here on the call. So let me relaunch this. And if you could just take a second and let us know who you are. We'd like to know who's here. Are you a self-advocate? Are you a family member or a caregiver? We often have self-directed employees here on the call. Maybe you're a support broker. Trish, you're seeing this poll, right? Just making sure. Yep, I see the answers. The next question asks if you are currently using self-direction for supports and services. We realize some of you are just here to learn about self-direction, but maybe some of you are already doing so. And if you are self-directing, are you currently using a fiscal intermediary? You'll recall when you registered that we asked you for any questions you might have. And I can tell by those questions that many of you were probably not yet using a fiscal intermediary. And not that you have to, but just that you weren't. Okay, so let me just end this. So great, wonderful. We have a lot of family members and caregivers, wonderful. It looks like we've got a 50-50 break pretty much on who's self-directing. And we have slightly more folks here who are not using a fiscal intermediary. So, okay, great, thanks. That was very helpful for us. So our presenters today, let's dive in. I mentioned Asia Tang from Easter Seals, Donna Shireman. Forgive me, it's not Kimberly Smith, but it's Suzanne Crisp who will be co-presenting with Public Partnerships. When we're done with each of those, we'll take some time for some Q&A, and then we'll share the resources that are available from DDD and from CLEP. So I'm going to stop sharing my slides. Asia, if I can trouble you to go ahead and open up your slides. And while you do that, let me give a proper introduction. Asia Tang is the program director with Financial Management Services. And don't be confused, that is connected to Easter Shields, and she's going to explain that in a minute. Asia's passion for working with individuals with disabilities started in high school when she worked as a DSP supporting children with rare diseases that cause various disabilities. She notes that that passion continued to grow in her and brought her to where she is today with over 13 years of experience in directing programs, and 5 of those specifically are working with nonprofit organizations. As the mother of a child with a rare disorder who has experienced some similar obstacles as some of you may have had some challenges with, Asia does feel she has some insight and understanding about what families and individuals may be facing. She strives to create inclusion and understanding and to provide the needed support to help create a better life for all individuals and their loved ones. Asia, it looks like I can see your slides. So if you're good to go, I'll turn it over to you.
Awesome. Thank you very much. Again, everyone, hi, I'm Asia. So just understanding agency with choice with financial management services. So financial management services is still a part of Easter Seals. We want to assure you that we are still working with the exact same team that you're accustomed to at Easter Seals. But because Easter Seals as an organization also provides additional services like with other providers, state programs, group home, our camp, etc. The state of New Jersey did ask that we make some clear distinction between our financial management services and fiscal intermediary services and what we do, on our Easter Seals side. So the best way for us to do that was to create the financial management services umbrella, which is what the Agency with Choice program falls under. So when you receive anything from us, if it says financial management services, it is still Easter Seals, and we are still under the same roof. It is just a different name. All right, so as of February 1st this year, Agency with Choice was available to all interested in using self-direction and working with a fiscal intermediary. This is an example of a co-employment model where the agency is the employer of record and the individual or family member is the managing employer. With financial management services is the fiscal intermediary for the Agency with Choice model. So choosing Agency with Choice, if you're interested in utilizing Agency with Choice, you would first connect with your support coordinator. You would discuss the conversion to fee for service if that is still applicable to you. Your support coordinator would advise on your 3 service options using the fiscal employer agent model or the Agency with Choice model or utilizing a provider agency. Financial management services does have a provider agency service that is accepting new consumers as well, but that is not to be confused with Agency with Choice, our self-directing side. The support coordinator will provide the individual or family with the SDE options, FAQ, and side-by-side comparison documents to give you an overview of your options. And if you're still interested, then the individual and family selects Agency with Choice. The support coordinator would submit an electronic referral that we would receive to initiate the enrollment process. If you're utilizing a support broker, at the bottom of the initial form that you will receive for the SDE rates, there is a space to indicate that you are utilizing a support broker. And once the managing employer indicates that they wish to use a broker, you will receive a support brokerage authorization form. And completion for signing this form grants us as the fiscal intermediary permission to speak with that support broker. Things to remember for the individual's budget to move to Agency with Choice and be eligible, there must be 1 SDE service attached to the plan. Agency with Choice does not currently do vendor service only. There must be at least 1 self-directing employee. Once we receive the electronic referral, we will start sending documents through our Adobe Sign system and a little milestone checklist to get you started and guide you along the process and connect you with one of our customer service representatives that will work with you through your enrollment process. Once the managing employer completes and submits that initial SDE rate form that identifies the prospective rates that you would like to pay the SDEs and captures some training information, then we will use that form to identify the additional necessary enrollment documents and send the billable rate information to the support coordinator. If adding transportation, remember transportation is reimbursed under the fee for service in a 15-minute increment, and there is no gas or mileage reimbursement. There can be a different reasonable and customary billable rate for when the SDEs provide transportation services, and transportation services must meet minimum wage requirement, which is, we get lots of questions about transportation for our existing self-directing families. For vendor enrollment, Agency with Choice does not approve or deny vendors. We do not have a list of approved vendors or anything like that. We will enroll the vendor that is in the approved plan of care. If there's a question on which type of vendor services that are allowed, it's best to work with your support coordinator on that. Once we receive the authorization from the approved plan of care, we will begin the outreach to the vendor. So there is no pre-vendor enrollment that needs to happen prior to the approved plan. And again, like I said, a consumer must have at least one self-directing employee in their plan of care to add vendors. For vendor enrollment, vendors are sent through Adobe Sign, the W-9 electronic funds transfer letter, vendor request form, and their certificate of liability. We also do provide them with the section of the support manual that provides their service description and expectations. Once enrollment is complete, the vendor is sent a voucher to submit for services rendered and voucher instructions. The role of financial management services and Agency with Choice. We ensure that the self-directed employees complete and pass pre-employment background checks and drug testing. We ensure that SDEs complete all applicable DDD mandated trainings. We ensure payments, we issue payments to self-directed employees by the individual or the authorized representative. We issue payments to community vendors that have provided prior authorized services to the individual. We ensure appropriate service documentation is submitted by the SDE and, when applicable, the vendor. And we ensure services and service documentation align with the individualized service plan. And we will submit the claims to Medicaid for services that have been rendered. What individuals and families need to know: there is a monthly administrative fee to participate in the Agency with Choice model called our per member per month fee. DDD pays the same amount towards the Agency with Choice per member per month fee as it pays towards the fiscal employer agent model, towards the administrative costs. The individual budget funds the remainder of the per member per month fee. The individual and family is able to determine the employee's hourly wage. It must be reasonable and customary, and it must be able to be supported by the individual's budget in addition to the per member per month fee. And employee hourly wage is marked up by approximately 15.01% to cover employer-related taxes and workers' compensation. Employer-sponsored health benefits are available to SDEs working 30 or more hours per week, which include our medical, dental, and vision, and other benefits like 403B. Paid time off is also available to all self-directing employees based on the number of hours and years worked for financial management services. This is our per member per month model. So there are 4 tiers to our per member per month model. It is based on how many of your self-directing employees elect in benefits. And if you share a self-directed employee with another consumer. All of our documents that we do send through Adobe Sign. This does allow for families to electronically sign documents without having to print them. And the new process does allow for faster and smoother completion of the documents when enrolling with the program. and helps expedite the process. And all that we need to utilize this process is an email address for each of the SDEs and the individual and family. With the Adobe Sign process, the support coordinator and support broker, if applicable, are copied when the documents are sent, and they actually get real-time updates with the completion of the documents. Even if we have to cancel the documents for any reason, we can add notes and kind of keep everybody in the loop at the same time. You will receive a notification when the documents are signed by each party, and you receive a final copy when they're completed. There is a reminder that is sent through the system every third day that the documents haven't been completed, just to make sure that you're not forgetting about them. And just note that with us working in hybrid remote model, there are some delays if we do utilize USPS, but that is still an option if that is something that is needed. So on the right here, it just shows what it looks like when we send a document through Adobe Sign. It'll come to your email. It'll look just like this. It'll tell you what you're signing. It'll give you information and comments, and then you just click review and sign, and it prompts you through the process. This is an example of the Adobe Sign email that is sent to all parties who receive the document or who are copied on the document. So for a support coordinator or a support broker, the handy thing about this is that there is always an attachment of the document. So as we start to return to more in-person visits and things like that, you already have those documents available for yourself. All signers in Adobe Sign are prompted to sign and fill in only in their designated sections, and it doesn't allow them to move forward unless their required sections are completed, which does help minimize the confusion of where should I sign or where should I put information, because it will only let you put it in one place. For hiring a self-directed employee, there is an automated process for hiring the self-directed employees. First, an application request form can be filled out by a managing employer. It is on our website and can be downloaded and sent to us, or you can contact us at customer service and we'll complete one on your behalf. This is what the form looks like. We do use this form for both old model FIS and agency with choice. So just be sure that if you are filling out this form to indicate which one. Once that form is received, the new hire process begins. Just please note that the new hire process is separate from the enrollment process into the program. New hires do have to go through other steps prior to being enrolled in the program. After the request is sent, within 2 business days, the individual or managing employer and prospective self-directed employees will receive an intake call from an onboarding specialist to review the new hire process and send the new hire required documents. The prospective new hire will receive the application, the electronic child abuse registration information link, background check link. They'll be scheduled for their drug screen, and they will receive the information to schedule their fingerprinting. The individual or managing employer will receive the I-9 form for employment eligibility verification, a job description, an employer reference check, and the Hep B form. Just again, note if you're hiring for the old model FIS, then you still it has to receive approval from DDD prior to the onboarding process. SDE benefits with agency with choice. So there are, again, employer-sponsored health benefits available to SDEs working 30 or more hours per week, averaged across 4 weeks. Paid time off for all SDEs is based on the number of hours and number of years worked for the program. Paid holidays for SDEs who meet the criteria, and ability to participate in 403(b) retirement plan, life insurance for full-time employees working 35 plus hours, long-term disability for full-time SDEs working 35 plus hours after 1 year. I have included the link, so when this does go out, the link to our benefit page to gather more benefit information is available. But just to briefly go over the medical benefit employee cost, there is a self-directed employee contribution to the benefits, and it is based off of their pay and income for the year, but these are the employee rates. They are semi-monthly, so they do come out of the paycheck twice a month. Agency with Choice, our PTO program, it does replace the traditional separation of vacation or New Jersey sick leave. You earn a little bit more than the standard New Jersey sick leave. This is to, offer an additional benefit to the SDEs and to maintain their quality of time off benefits for employee retention. So from the first year to the fifth year, the PTO earnings are a little bit lower. And then after that fifth year, they do increase. They get 80 hours in that first to fifth year annual max. And then for the fifth year and above, 104 hours. But every year at the end of the year, any unused PTO, they can carry over up to 40 hours with them into the next year. The holiday schedule, we do have 6 paid holidays for self-directed employees as well. New Year's, Memorial Day, Independence Day, Labor Day, Thanksgiving, and Christmas. And then if the SDE works on that holiday, they do receive the time and a half compensation. Training requirements within the program, the SDEs do receive notifications at 90, 60, and 30 days prior to their due date. Support coordinators and managing employers do get included on the 30-day communication. SDEs who cannot or do not complete trainings by their expected completion date do risk suspension without pay and an interruption of services. And there is no retro payment for the self-directing staff or agency staff for the period of time they were out of compliance and suspended without pay, but the payments will resume when they have completed their requirements and are reinstated. For all of the training requirements, with the exception of medication, an SDE has 6 months to complete. That includes first aid CPR. So that is ample time for them to get the trainings completed. If it is applicable and a SDE is administering medication, then they will have to complete that training prior to giving medication. We do offer first aid CPR for free at with our programs. So we do have several locations. It has been offered weekly at our administrative office. However, we have expanded that. So we do have a little more southern and northern sites for first aid CPR training. So there's ample opportunity for SDEs to get trained now that we are able to expand into some additional locations. Timesheet process. So when converting to the fee-for-service model, there is a case note requirement for Medicaid billing, and the AWC timesheet is a 2-page timesheet. The first timesheet, they record the date, time, and service code associated with the services provided. And on the second page, they record the date, individualized activity, location code, and service documentation. And both pages do have to be completed in full to be processed. And we did include an instructional link and video for how to fill out the timesheet. On the second page of the timesheet, where it has the location code, that was in alignment with the EVV requirements that have been established. So with those location codes, if you have an E for EVV, you would also check into the EVV system, which is HHA Exchange. And that is how we are utilizing EVV at this time. Though these are paper timesheets, they are fillable PDFs. So you do not have to print them in order to submit them to us. You can fill them out on any device and then email them into the system. Sorry, the top of my screen is a little chopped off here. Okay. So the responsibility of the fiscal intermediaries. So we are agency with choice. We ensure compliance with legal requirements related to employment of SDEs. We offer support services to enable individuals and their authorized representatives to perform required manager-related tasks themselves. We submit claims to Medicaid for the SDE and vendor services prior authorized in the ISP. We pay the SDEs and vendors. We withhold and file required state, federal, and local taxes in accordance with the labor and tax laws, rules, and regulations. And we assure SDEs meet all applicable standards and qualifications. And the role of the authorized representative or the managing employer is to take an active role in employing the SDEs, interviewing candidates, creating job descriptions, determining the hourly wage, and supervising the SDE. You work with the support coordinator to develop the ISP. train the SDEs in aspects of the ISP and understanding the goals set forth for the consumer, approve the SDE timesheets, provide equal employment opportunities to all SDEs regardless of their race, creed, color, national origin, sex, disability, and marital status in all employment decisions, including but not limited to the recruitment, hiring, and termination. And you inform the support coordinator of any changes in status, including the individual's medical condition, address, phone number, and hospitalizations. Continued for the agency with choice, we maintain liability coverage via workers' compensation insurance. We conduct at least annually individual satisfaction and quality control reviews. We obtain the criminal background checks and ensures required pre-employment screenings are completed. And we ensure all applicable mandated SDE training requirements are met. And we provide SDE training on appropriate service documentation and maintain e-copies of the SDE service documentation. And the role for the authorized representative or managing employer continued is to inform the FI agency with choice of any SDE incident or injury so that claims can be processed, arrange and schedule backup coverage for SDE time off or absence due to illness, and work with Easter Seals to resolve any SDE employment payroll issues. All of our forms and this information that I've shared with you is actually available on our website. So feel free to go to our website at any point. You can also sign up for communications from us, monthly newsletters, and periodic updates. And then I have attached our who to contact.
Okay, great. Thank you so much, Asia. I am going to just open up the poll that just to kind of do a quick review of some of the questions you addressed here. And then I do have a couple of general Easter Seal questions that came in earlier. So let me relaunch this. This is just to kind of, folks, I know there's a lot of information and it's a lot to pack into 30 minutes, but let's just take a look and see if we need to address a couple of the things. So first off, the first question is, how long does a self-directed employee have to complete their training and requirements, aside from the medication, if that's a part of the support they're providing? And then the next question was, does your SDE get medical and time off benefits through Easter Seals? I'll give folks 1 second. And I will go ahead and end the poll. And let's share those results. And Asia, I'll leave it to you to comment on these.
All right. So how long does a self-directed employee have to complete their trainings with the exception of medication? Over 64% of the group did do the 6 months, which is correct. It is 6 months from the time of their start date to complete those trainings. That includes CDS trainings, College of Direct Support trainings, as well as first aid CPR. And then does my SDE get medical and time off benefits? Majority voted yes, and that is correct. They get medical and time off benefits if they meet the requirements.
Great. Thank you, Asia. You know what I'm going to do before we hop on to PPL? There were a couple of questions that you all had asked when you were registering, and some of them are specific to Easter Seal. So let me just ask a couple very quickly while you're in the mode of all of this. You referenced in your slides, actually, if someone was working with a sports broker, that they would be involved in this process, but is that a requirement? Do people have to use a support broker, or is that not at all necessary?
They do not have to use a support broker. We do just gather that information if they are utilizing a support broker.
Okay.
There are benefits to using one. So if you're interested, definitely speak with your support coordinator about it, but you don't have to use one.
Okay, great. You also described the process for hiring a self-directed employee, and you listed some of those steps. How long generally would you say that process takes?
So the administrative process on our end, it takes about 10 business days. That is highly variable based off of the responsiveness of the SDE being hired, as well as the return of documents from the managing employer. Right now, the temporary clearance for fingerprinting has been extended. Normally, depending on that, though, fingerprinting can take a little bit of time to schedule. And without that temporary clearance in place, we do have to wait for that to be completed. So that is a big variable in hiring a self-directed employee.
Sure. Okay. And let me ask you one more question that came in through the Q&A. And Marion, this is a question that came from Marion. And Marion, I might ask you to add a little more clarity in the chat box or the Q&A. The question was, is there anything different in your process for community-based goods and service vendors versus more typical DDD vendors, which is in quote, and I'm not sure if that's enough information for you to answer that question. Marion, I asked for a little more clarity and if you can be a little more specific, but Asia, can you address that at all?
Yeah, so there is
Okay.
not a difference in the vendors. Once the vendor is added into the plan of care by the support coordinator and it is approved, our enrollment process for the vendor is the same. That would go the same for activity reimbursement and goods and services if it were going to an SDE. Our process is the same as far as that enrollment goes. So it doesn't make a difference on our end for any type of vendor.
Okay, and I think that's exactly, Marion added, for example, a local gym versus a day program vendor. And I think you've just answered that, right? It doesn't really matter. Okay. And I'll just share two comments with you that came in through the initial registration. One was a hope or a comment to go back to the one-page format for timesheets. I don't know if you want to comment on that at all or not.
Yeah, I can. So with the change and the conversion to fee for service, there is a case note that is required, with each of the days that the SDE works. It is only, 3 to 5 sentences that has to be added, but that is why there is a second page. That second page is really solely for service documentation. And that is why it is a 2-page timesheet.
Okay, great. Okay, thank you. And I do want to address this question. Tricia, I think this answer might need to come from you because this just came up. The extended emergency hire process, I think there was a new extension date. Do you have that offhand, Tricia? You're muted. And if not, we can come back to that afterwards if needed.
All available on our website. So, and everything about that is up on our website. So
Okay, well,
and it comes out with division updates as well, and that's still in process. So the emergency hire process is still in effect as of right now, and all updates come through division updates. So if you've signed up for our division updates, you should get them. It is all available on our website.
Okay, and I'll see if I can pull up that exact, I know that came out a couple of days ago, so let's see if we can find that specifically. Okay, great. Thank you. Asia, thank you very much. If I can ask you to stop sharing your slides at the moment, then I'm going to go ahead and open up the slides for our next presenter. Let me just get this open, and then I'll go ahead and introduce our next presenters. Thanks very much, Asia, for that. I know it's a lot to pack in. Let me share these. And Donna, if I could just ask you to confirm that you're seeing your slides up here at the moment. Donna or Suzanne, are you seeing your slides? I don't hear either of you. You might be muted.
I can, yes.
Okay,
Sorry.
great.
I thought you had
Oh, nope,
Yep.
that's yep. Okay, so let me go ahead and introduce our next speakers. Suzanne Crisp has over 35 years of experience developing innovative strategies to provide opportunities for individuals to best experience living in the home or the community. She is currently a senior advisor with Public Partnerships for PPL, the nation's largest financial management service entity. She develops policies and procedures and activities related to self-direction, both at the state and national levels. She has been involved and instrumental in most of the foundational self-directed Medicaid programs through her work at the Centers for Medicare and Medicaid. Donna, who many of you will know, Donna Shireman, has focused her career, which has spanned over 30 years, on aging adults, as well as the start of the Medicare Advantage plans. But more recently at PPL, Donna has been working with state and government leaders in New Jersey to advance self-directed programs. Her commitment and passion and focus has been instrumental in bringing the Self-Direction Conference to New Jersey. while working with key stakeholders within the aging and intellectual and developmental disabilities community. She has extensive operational experience, which has been really instrumental in developing relationships with organizations to execute successful community events. So Donna and Suzanne, thank you both for sharing the how the PPL process works, which is a little different than agency with choice. So I'm going to go ahead and put the slides in the
Sure.
chat box, folks, for you to have that, and I'll also email that out afterwards.
Great. Thank you so much. Again, my name is Donna Sherman, and Suzanne and I are going to share this presentation, based on, where more of our knowledge comes from. So if we could just go to the next slide. I just wanted to offer that, we as the fiscal intermediary in New Jersey, also there are 3 programs that we work with. So today, obviously, we're going to be focusing mostly within the DDD program, but, we work with the chronically ill, aging adults, individuals with disabilities, their family representatives, in the personal preference program, which is another program that we work in, and some of the folks, actually many of the folks that are on the DDD program are also in the personal preference program as well. So we work with, different states, we work with the managed care organizations, and then, the Office of Medicaid and, they're obligated to choose an FMS and to work with us. So that is how we kind of come about in the grand scheme of things. If we could go to the next slide. Public partnerships, we have, business in multiple states, New Jersey being one of our largest, and, really the state that we utilize many of the times to, to do our, for our other business. I think, there are a lot of things that go on in New Jersey, whether, we control it or the state controls it, that happen that are really, things that other states, when we go to conferences or things, look at as, the way that they perhaps may want to do business. So we should, feel proud of that. Why don't we go to the next slide? So just, as far as, PPL is concerned, just a general overview is, we have like 50 plus government clients. We work with 22 MCOs in the state of New Jersey. We work with 5 MCOs, and you'll see that a little bit later. So it's just a little bit about us and a little bit about our, our INA services that we offer through the personal preference program. If we could just go to the next slide. So just the 3 programs that we work with real quick are the Jersey Assistance Community Caregiving out of Department of Aging, which we refer to as the JAC program. And that is a state-funded program, sometimes a feeder program into our personal preference program. The personal preference program is through New Jersey Family Care, to qualify for PCA, you get a script from the doctor, and you work through the 5 MCOs that we have in the state of New Jersey to kick off those services. Whereas the focus today is on the Division of Developmental Disabilities, which is also, a program where individuals need to be 21 years of age or older with intellectual and developmental disabilities. Let's go to the next slide. Okay. So I'm going to already turn it over to Suzanne. Suzanne's got a lot of information regarding like the supports program, and then we'll get into the nuts and bolts on, what exactly we provide. But, I do realize there is a lot to unpack. I've seen some people write that, and, that's why we assign a person at Public Partnerships who will walk you through this process of enrolling yourself, of also enrolling your SDEs initially. So, I don't expect you to capture everything today, but at least we'll give you, at a high level, the process and an understanding of it. And then, we'll also provide you with contacts as well so that you could get started. Suzanne, you want to take the next several slides?
Well, first of all, it's a real pleasure to be here. I have worked with self-direction for about 25 years. And beginning a program in Arkansas, one of the first cash and counseling programs. And then I went to the federal government and talked them into adopting self-direction on a national level. So you may have me to thank for all of this program operational issues. But we did talk CMS into supporting, and CMS is the Center for Medicare and Medicaid Services. But we did talk them into trying it out, and now we have about 1.2 million people who are using self-direction in their Medicaid home and community-based services. So that it's been very, very successful. So originally, Medicaid said that you have to adhere to labor laws and IRS regulations, that they could not support a program that did not comport with sister agency regulations and compliance issues. Initially, we thought that people could be deemed independent contractors and simply be issued a 1099, and then the worker would need to manage all of their own taxes and as a sole proprietor. But IRS said, no, you really do need to identify who is the employer of record. So CMS came up with the term financial management services, and this is to ensure that each state self-directed program complies with the labor laws and IRS regulations. They did want to give people choice of what model they wanted to select. First of all, there's the agency with choice, which we've just heard. This is where the participant is the co-employer. The agency is actually the employer of record for IRS purposes, and the participant then is the managing co-employer of the worker. So the participant recruits and refers for hiring over to the agency. And in the case of New Jersey, it is Easter Seals. Then there's a second model that we represent here at Public Partnerships, and it's called the Fiscal Employer Agent model. And this is where the actual participant is the employer of record. So the participant is the individual who is responsible for hiring, recruiting, training, and managing the individual. So it's very pro participant, and choice and control are on the participant side. And why the two different models? Well, the federal government wanted to provide choice to participants to select from. And also, back in the early 2000s, the DD community felt strongly about continuing to be involved in the relationship that individuals had with their workers. So hence we have the agency with choice and the fiscal employer agent model. And New Jersey is rather unique in that it provides both models for the DD communities to select from. Many states just offer one or the other, but New Jersey has chosen to allow participants to select even what kind of financial management services agency they wish to pursue. So uh, okay.
Oops. Oh, sorry.
Okay. No, I was just going to say, so the employer of record is the main differentiation between the two models. So we've got the Easter Seal model and the public partnership model. And the only variation is that the employer of record is different in those models. Okay, next slide.
Thanks. And Suzanne, I'm just going to point out the question that someone asked earlier.
Okay.
That in case others didn't hear it, can someone use both agency of choice and PPL? And it does appear that that's not an option, that you need to have one fiscal intermediary. And I just wanted to make sure everyone saw that or heard that question because it was asked in our Q&A. Thank you. Go ahead.
Okay. So in the fiscal employer agent model or the public partnership model, the participant is the employer of record. PPL serves as the agent of the participant. They sign a form with the IRS that says, yes, PPL can act as the agent to the individual. And PPL is in charge of taxes and insurance and absorbs all the liability on behalf of the participant and family. So between the two models, there's not a matter of one is more liable for the participant and his or her family. It's that the agency is either liable or public partnerships is. About 88% of the self-directed programs use the employer agent model. This is changing though. A lot of states are saying, well, the agency with choice model makes a lot of sense because for one thing, we can pay benefits, we can pay health insurance, we can pay um, vacation time, things like that, things that workers are really interested in receiving. But the fiscal employer agent, as I said, it provides the greatest level of participant choice and control. So next slide, please. So let's look at some of the benefits of the fiscal employer agency. True choice and control is one of them. It is identified as the purest form of self-direction. FMF vendors serve as the legal agent and assumes liability, so the participant is not liable for extra responsibilities under this model. The payment to the FEA to PPL is transparent and it's a one-time per member per month fee made each month. So it's very predictable for both the state and the participant. There's a real clear delineation of roles and responsibilities between the two models. There are bright lines of distinction, whereas in the agency with choice model, sometimes it's the participant does this and the agency does that and the worker does this. So it can be somewhat flexible. It allows the function to be monitored for quality improvement and assurance. It also it additionally assists individuals with the information and assistance. In other words, there is a component of support brokerage that helps an individual um, self-direct. If they have questions about, is this legally may I do this legally in order to hire a person or whatnot, there's the information and assistance component that helps. It also allows the participant to focus on the day-to-day management of the worker and not the taxes and liability insurance issues. It requires information and assistance also. Um, so is that my cue to hurry up? I don't know. Okay.
No, no, not at all. I thought you had finished that slide. I'm sorry, I was watching
Okay.
the last box. My apologies.
No problem. And I will keep going. So the next slide.
But we probably do need to speed it up. Yep.
Yeah, okay. I'll speed it up. So what are the
You're
challenges?
okay.
What are the challenges of the fiscal employment agent? Well, if a person needs substantial assistance with managing the worker, there is more assistance on the agency with choice or co-employer side with the agency. If the information and assistance function is weak, then there may not be sufficient support to ensure that the participant self-directed experience is successful. Rarely are health benefits covered for workers. There are ways that this can happen, and I'd love to work with the state in making this happen. It's called the reassignment of Medicaid claims. But it is possible for workers to be covered under health insurance, but it does need to come from the state. Backup plans require more deliberation. With an agency with choice model, the agency supplies the backup. With a fiscal employer agent model, we usually rely on family and friends to uh, provide backup services. And the PPL model takes more time to enroll. There are more forms. There are more processes that involve the IRS and in state labor law. So it takes longer. It takes a couple of weeks as opposed to 1 week. The next slide, please. So PPL is very committed to self-direction. I know we're large. I know we're in a lot of places. We have a lot of programs out there, but we still take pride in operating under a system that uses centered planning principles as well as self-directed principles. We believe that self-direction is important for people to stay at home and avoid institutions. We think that self-direction allows personal services to be tailored and personalized to meet individual needs. We think that direct service workers can relate to the people that they serve, oftentimes hiring friends and family, even in some instances, hiring legally responsible uh, friends and family. For example, spouses of minor children or spouses or parents of minor children. And they allow creative, flexible ways in order to meet individual needs. Evaluation studies show that there is a higher satisfaction with the service arrangement for self-direction, and it's a way to be your own boss, to take control of your services and supports and manage those to the way that you feel is necessary to meet your needs. And it's proven to improve lives for individuals and their families. Next slide, please. So the next few slides are going to be what PPL offers. In this slide, we talk about orientation, training, and enrollment. PPL provides a user-friendly, pre-populated enrollment packet that can be completed in person, online, or over the phone, or even through the mail. They provide orientation and training for participants and providers on program rules, pay periods, timesheets, due dates, and how to avoid common errors. They also help an individual identify eligibility for overtime exemption, tax exemptions, difficulty of care exemptions. So, and how we do this is our online enrollment through Better Online. It's a web-based platform that expedites the enrollment process to the degree that is it can be expedited. It's a dedicated enrollment team that assists with the packet completion. Um, there's online competency-based training, and there are electric options to determine difficulty of care, status of living, exemptions, and tax exemptions. Next slide, please. We also provide timesheet and payroll and invoice assistance. We have a mobile app that is web-based, but it does allow for paper exceptions. We use a direct deposit to directly deposit all the payments for workers into their own checking account. So the Better Online is a web portal that participants can access to review their enrollment forms, their individual budget balances, service operations, authorizations, timesheets, and invoices. And they can access real-time history payment 24 hours, 7 days a week. It's integrated with PPL's EVV, or the Electronic Visit Verification Solution. So we work closely with the EVV that has been selected for New Jersey. We also have a budget calculator that allows participants to use this to estimate future expenditures to prevent over or under expenditures. We also have online W-2s available for individuals. Next slide, please. So training topics, we feel strongly that training should be an integral part of every participant and worker, and have that available to individuals in a user-friendly manner. So we provide orientation, what are the risk and responsibilities of workers as compared to participants, what the difference between budget and employer authority are, enrollment documentation, how to recruit, screen, and schedule employees, how to manage employees, how to understand billing and documentation requirements, how to submit timesheets and approve timesheets, how to purchase goods and services, and how to resolve conflicts. All of these trainings are available to both participants and to workers through our learning management system, which is online training. Next slide, please. And of course, we, as all states are required, we have to have an electronic visit verification system. This is the law. It was created under the 21st Century Cures Act. Every state has to go through this. I hope New Jersey is faring well with this. Many states are having trouble with compliance of the EVV system, as well as individuals understanding what they should do and when they should do it then. But we do work closely with the electronic visit verification vendor in New Jersey. Next slide, please.
Before we advance, I just want to ask Donna or Suzanne, if perhaps whomever is not presenting, might I trouble you to locate on your website the budget calculator that you just referenced? And perhaps we can pop that into the chat feature. It doesn't need to be this second, but if you can,
Okay.
before we answer, there were a couple of questions about that. So I just
Okay.
wanted to give you a chance to grab that. Thank you. I'll go to the next slide.
Okay. And then our customer service, as the slide that Donna presented shows, that we have over 280,000 calls. So we have to be efficient with how we manage customer service. All of our staff are trained with the self-directed principles, as well as person-centered thinking, practice, and planning. We have culturally competent staff. We answer calls promptly, and we have the ability to have multilingual agents and translation services. We have real-time access to program information, and that's 24/7. We have an automated outbound call to alert consumers if there are issues that arise, if something's going to be late, or if something is needed overall and everyone needs to comply with a certain issue. We can do a push out to each participant. We have a message of the day that improves capabilities. We have an interactive voice response system to allow individuals to receive common request automatically. And we have a compliant tracking and reporting to analyze trends. We also have a new feature, and it's called the Customer Relationship Management Platform. If you call one day and something is supposed to be resolved, and you want to check to see if it's resolved, you can call the second day, and it will pull up your profile and provide a history of activity, so you don't have to repeat everything that you told the person the previous day. And the next slide, I think I'm handing it over to Donna, and I'll look for that budget calculator so that we can show that. But I'll turn the slide presentation over to Donna now.
Thank you, Suzanne. And if you can just pop it in the chat box, that would be great.
Thank you.
Sure.
Yeah, I was just looking for it, but I didn't have enough time, so thank you. So I just wanted to touch base on the fact that on our website, we do have the links in here in the later slides, you know, just like Trisha Brennan was saying, you know, about where things are on her website, same thing for us. We have, you know, many, many great tools and resources and information on our website. We also have a lot of really great videos on self-direction to gain a better, you know, high-level understanding of what it's done for people's lives. These are not commercials that we've created. These are real participants and their families that are in these videos. So you're hearing it straight from them. And I also wanted to just touch on, I know that Suzanne had mentioned something about, you know, health insurance. Within our model right now, there is no ability to have health insurance. While I think policy dictates that it could potentially be a possibility, you know, if it was looked at a little deeper from a policy perspective. But right now, it is not. It's not something that is offered within this program. So, all right. So, just wanted to talk a little bit about how consumers become enrolled. If we can go to the next slide. So, you know, essentially in the DDD model, you would go through your support coordinator who would determine the level of interest in self-direction. And if you're interested, you would then choose between the two models, which currently in New Jersey would be public partnerships or Easter seals. as you'll understand more and be more educated after today on what the different models offer and what you may very much need. I think within our model, when things are very complex, you need to make sure that you have a solid circle of support. We're going to be talking about that in some future webinars that you can look out for in the future through public partnerships. We offer that through our social media. You'd be able to see that those are coming up, but I think it did come up in our conference, and I do think it's very important because sometimes, it's complex. It's not always easy to self-direct, but it is, it is a wonderful program to be able to stay independent. So I think, an understanding of these two programs is great. So I'm really glad that CLEP offered this. But the individual refers the potential worker to the agency or hiring commences. So support brokers, similar to what Asia said, you don't have to have one, but it is definitely something that is helpful to folks depending upon where they are at with and how they feel with self-directing and the process. But you would talk to your support coordinator about that. If the individual is interested in the PPL model, a referral to PPL is initiated by the service coordinator, the support coordinator. And then we go into, the process. We actually have someone who would be assigned to you, and they would walk you through that initial process. They would walk you through all of the enrollment packet. They would walk you through initially enrolling your SDEs as well. Let's go to the next slide. This is much more the PPP model, so I just wanted to include it, but it's a different process. You go through the MCO case manager, and they determine the member's level of interest and the budget, and then it gets changed over to us. So if you're interested in that program, it's just a different process, and I wanted to make sure that I included it, especially since many of our DDD folks also have PPP or are eligible for both programs. You can go to the next. And this is just, I included it. It's also for the PPP program, and it will list the 5 MCOs that are there and how you get started. If we could go to the next one. And as well, we also have information and assistance for the PPP program. And we are partially offering that on the DDD program, I would say, through having someone be assigned to you when you do your initial enrollment to help you through all the paperwork that's involved, and and allowing you to be the employer of record, allowing you to go through the process of the drug testing and the trainings and the different things such as that. So if we can go to the next slide. So essentially, if you'd like to get started, if you're interested in being the employer of record, if you're interested in our model, you would go through the support coordinator, and then we would receive the referral and we would get started. I would say, it does take a little bit longer, approximately, 30 days, give or take, because it's a give and take process. As we're going through it, there are things that we have to do, and there are also things that you have to do, and there are also things that the SDE has to do. So it depends, if everyone, we're in line and in sync and it was a perfect world, we believe that it could be done in an aggressive manner, probably in a few weeks, but, typically it's, taking between 30 and 45 days for enrollment. Certainly, we are happy to help anybody who needs something, as an emergency. I think, working with the state, working with us, working with support coordination, we would be happy to, to get some, we have in the past, especially during COVID, been able to help some families with some emergency situations. So on the contact sheet, offering, our phone number, our website. We also have social media access. If you go on our website, you can ask questions through social media that get answered and responded to pretty quickly. And then our local contact for DDD is Claude Schminke, and his direct number is there, his email address is there. And then for PPP and Jack, it's Ricky, and his phone number, and his phone number is, I think, down there, but I think it got lost, but you'll be able to see it when you pull it up. And I'm not sure if there's, yeah. And then, so here's a lot of the other different contacts as well. So the customer service, the emails for the trainings, you know, similar to you know, what Asia said, yes, there, you know, we do offer what the state offers as far as sick time is concerned. It's 40 hours. So with, you know, that we have, you know, there, all of our contacts, all of our information, everything, FAQs, everything is on the website as well.
And is that your last slide, Donna?
I believe so.
Okay, here's the side-by-side comparison, and I will just mention, I'm going to add that link directly into the chat box as well, but Donna, I'll let you wrap up on here, sorry.
Yeah, no, that's fine. So, you know, I think there's a lot of information. I'm glad that, you know, someone is assigned to you to be able to walk you through the process initially. And, you know, again, I think the circle of support is where I've seen, you know, the most success, you know, which includes the support coordination, it includes the FMS, it includes individuals in your lives that help you, you know, for in different ways. And I think makes the process, you know, easier. I know that we at Public Partnerships are also looking at more of a succinct online system. So we have worked to implement it in other programs, and we are looking to do that in the upcoming year. And so you'll hear about that more. We're trying to do more education, more webinars, you know, the self-direction conference and our involvement in that. So, you know, look out on our website. There's always information about, you know, what's going on as well. And we're, you know, happy to help you. We know that there have been challenges. We know sometimes getting through has been difficult. So I hope that these contact numbers, you know, offer you something beyond that if you are having those challenges.
Is that,
And I'll turn it back to you.
I believe that's your last slide. Okay, let me stop sharing
Yeah.
here. Thank you, both Suzanne and Donna. Thank you for that information. We do have some questions, and I'm going to try to keep these as general as possible. Donna, I'm glad to hear you referring to trying to streamline things. There were lots of comments for both providers, you know, about trying to make this an easier process and a more streamlined process. I think there's, I'm sure you have heard some frustrations around the amount of paperwork, and some of that is, you know, federal government requirement, state government requirement. We get that, but to the degree that you can, streamlining, and I would toss into that comment, using plain language is critical. And the federal government has made a very big move towards using plain language in any public facing documents and applications and paperwork. And I can't stress enough the importance of clear, plain language, right? To make it, it's just a lot. It's a lot to digest, and the simpler you can make it, the better. There are a couple of general questions that came in earlier, and then I'll get to the ones online. Is there a way, this is for both of you, Asia, I believe you're still here. Is there a way that overtime is handled at all? Is overtime allowed given the staff shortages? Can either of you kind of comment on that and how that might work?
Yes, I can. So right now, because of the state of emergency with COVID, there are ways to get overtime approved. It does need to go through your support coordinator and get DDD approval. Naturally, it would not. However, with everything going on, right, the staff shortages, like you mentioned, there are ways to do it. And we, you know, obviously pay overtime. It just has to be approved in the plan of care first and approved by DDD.
Okay, got it. Thank you.
And
Go ahead, Donna. Yep.
And yeah, and from a public partnership perspective, I mean, overtime is not available as an option normally in the program. However, if you do live in and you have a live-in exemption, you live in with the employee, there is that exception, and you can work over 40 hours. And then very similar to what Asia said, you know, exceptions would have to go through the state.
Okay, thank you. what came up earlier was the question about the extension of employment for emergency hires, and Tricia was kind enough to share the link to that. So I just wanted to draw your attention. I've just reposted it into the chat box since that might be addressing some similar themes. Another general question was, is housing or rent covered under the same processes as other services? I hope that question is clear enough. This was something that someone submitted when they registered.
You know, typically, Medicaid does not cover housing. I think they are considering that for future benefits, and the collaboration between Medicaid and housing resources is becoming a little bit, it's becoming more apparent. But currently, Medicaid just does not pay for housing.
Okay. Asia or Donna, did you need to add anything to that or? No?
No.
Oh, okay. The next question was, what if I'm not connected to an HHA exchange? And I think, Suzanne, you may have mentioned the exchanges.
I think that's the.
I think Asia did.
Yeah,
Oh,
Asia,
okay.
you want to handle this question?
Yeah, if you're currently enrolled in our agency with choice model and you are not connected through HHA exchange, I can put my contact information in for that specific question. You should, but I can send over any documents, but that is only if you are utilizing the agency with choice program. If you are in the other model, it would not be HHA exchange.
Okay, great. If you can, and in fact, I will share everyone's contact with the follow-up email, but Asia, please do feel free to chop it in the chat box. A couple of questions that have come in online. One is, how does one become a qualified vendor to provide services to participants? And I'm actually not certain if that question really goes to you or to DDD, perhaps. I know, Asia, you said that you're not, as long as it's in the plan, you're not approving or disapproving vendors. Tricia, go ahead. You've unmuted
I was just
yourself.
gonna say that is also the whole section on our website that talks about how to become a qualified provider.
Okay, so they should work with DDD for that process, not with either fiscal
And we have a
intermediary.
whole provider enrollment unit.
Wonderful. Okay, great. And Tricia, can they just contact your help desk for that information? Look on the
That's fine.
website?
And they also have a help desk on our website as well.
Okay, awesome. Thank
So
you.
I can look that up and try to drop in the chat as well.
That'd be great. Thank you. Let's see, the location. Okay. I just want to get some clarity on the budget calculator. And I'll leave this Suzanne or Donna, and if you can't do it now, then just send it to me. The document that was posted online was a PDF file, and they're wondering if you could send a link to the actual calculator that I guess you can use on the website.
I just dropped it in the chat.
Thanks, Trish. Okay, the provider, oh, you sent that to me. Let me just copy that for everyone.
It's not letting me send to the whole chat, just to the.
I got it. That's okay. I changed it to everyone, no problem. So we'll try to get that live calculator link out to everybody, if not before we hang up. And again, it is a lot of feedback on trying to streamline the processes, streamline that's a definite theme for sure. Asia, thanks for adding in the comment. Let me just make sure this goes to everyone. The link for HHA exchange. Okay. I think I'll give it one last, if there's any general question that folks would like to add in. I don't see any Q&As coming that are kind of general enough that we can answer at the moment. So let me just reshare some slides here for a second. And Tricia, I think this will kind of be going right back to you for a minute.
Sure.
And hold on one second.
And Colleen, you can feel free to share the answers to the pre-questions as well.
I will do that. Thank
if you'd
you.
like.
I absolutely will do that. Thank you. And let me just share these. Okay, Tricia, do you want to make any comments on your
I just wanna-
contact info? Oh, go
I
ahead.
can just say that this is our contact info, and if you do have additional questions after you end today and you're looking for some questions on self-direction or something you may have missed, that we can get you that information, please feel free to email us. I want to thank everybody for coming today and listening as we're building upon the different streams of how can you self-direct, what are the different facets, what are the different pieces, what do you need to know to do it successfully. And if you have additional feedback, comments, questions, please always feel free. One of our staff members will always be able to outreach back to you and answer questions.
Awesome.
Okay.
Thank you, Trish. And I will add in the CLEP contact information is here. Again, these will all be sent to you, so don't worry about capturing any of this information. We encourage you to sign up for the email listings so that you get these notices directly. Our next session is coming up on Tuesday, September 6th. This is just after Labor Day. And we'll be talking about using the interactive map. Some of you may be familiar with this. It's a fantastic tool from the New Jersey Collaborative that can help connect DSPs with individuals who are looking for employees and employees who are looking for opportunities for working. So we encourage you to join us there. With that, I think, so there are a couple of questions that actually came in. Let me just check our time. Let me grab these before we hang, since we have a few more minutes. One question is, can a vendor provide services for a relative? And I think what that's probably getting at is, can a relative be a DSP, be a self-directed employee, forgive me. I hope I'm kind of capturing that appropriately, and I'll just open that up to anyone, to Trish or either of our presenters, any of our presenters.
Yes, a legal guardian can be hired as an SDE. They go through all the same hiring processes as a, regular standard SDE. And they still, they have all the same requirements as far as training and case notes and things like that go. And under the agency with choice model, they are offered, benefits and things. They're treated like a standard SDE. But it is now allowed that a legal guardian be hired for as an SDE.
And Asia, are you saying a legal guardian only, or it can be any relative?
It can be any relative.
Okay, I just wanted to, because that's a big distinction.
Yes, it can be any relative. There were some before some distinctions about a legal guardian's not being able to be the self-directed employee, but that has changed. So it is allowed now, specifically to legal guardians and any other relatives.
Okay.
And the manual has been updated to reflect these changes.
Oh, thank you, Tricia. Okay, great. Let's see, I just want to make sure for this question, what about a vendor, not a self-directed, for example, if a relative owns a training? Okay, let me add one piece to that question. So what about a vendor, not a self-directed employee? So for example, if someone owns a training business, or in this case example is just a dog training business, but maybe it's an art studio or something different, can that vendor be approved by DDD?
I'm sorry, just to clarify, can a family member be the vendor? Is that what we're asking?
I believe that's what this individual is asking, and so I'm going to toss one thing out, and Tricia, you might need to clarify that.
I need further clarification.
You might need some.
Yeah,
okay.
So if this is something that maybe they could write in and ask that question, because we need a little bit more clarification as to what the question is being asked.
Okay, no worries. So I will be sharing again that contact information, the help desk question, so that you can ask that question specifically, Cheryl. Thanks for raising that. With that, I'm going to thank you all for your time. Presenters, I know this is a lot to present in a really short period of time. Thank you for taking the time to do it. Slides will be getting sent out. Evaluations will be sent out. Please do give us your feedback, good, bad, or otherwise, so we can help make these better. And we'll look forward to seeing you all in September. Trish, is there anything else you need to wrap up, or are we?
Nope, I'm good. I just want to,
You're good?
again, thank
Okay.
everybody and have a good rest of the day.
All right. Thank you all. Have a great rest of your summer too, I guess. We'll see you all in September.
Yes.
Thank you
Okay,
very much,
thank you,
everyone.
Thank
presenters.
you.
Bye, everybody.
Take care. Bye-bye.